on KDKA TV News starting at 4. Well, October isn't just Bucktober, it's also Breast Cancer Awareness Month. And on today's show, we'll show you a new tool in early detection right here in Pittsburgh. It involves thermal imaging. There's no pain involved, and it promises to find breast cancer in minutes, years before mammograms can. We'll show you how it works ahead. Next, a new tool in the fight against breast cancer, thermography, that promises no pain, no radiation, and earlier results. We'll show you how it's being done in Pittsburgh just ahead. Welcome back. As we look at the fountain outside KDKA TV in Gateway Center, you can see the water is dyed pink for Breast Cancer Awareness Month on this Sunday, October 9th. Now, one of the most important messages for Breast Cancer Awareness Month is the importance of early detection through self-exams, regular mammograms, and now a new procedure that can also help. It's called thermography. It eliminates some of the reasons women often put off getting a mammogram. It's pain-free, there's no radiation involved, and the thermographer doesn't have to touch your breasts. And it's being done right now at HEAT, or Health Enhancing Thermography, in Bethel Park. HEAT owner and certified clinical thermographer Bethany Neri is here to tell us more about the new technique and how it works. Bethany, thanks for joining us.
Thank you for having me.
Yeah, so first of all, explain what thermography is, because it's kind of a new concept, I think, for people not in the medical field.
It has been FDA approved since the early 80s as an adjunct to mammography, but thermography is a test of the body's physiology, so it's just looking at how the body's functioning, and it's able to detect abnormalities by looking at skin surface temperature and abnormal temperature patterns.
So that's where the thermography, we think of sometimes thermal like heat, it has to do with the heat?
Correct. It's your own body heat, so there's no radiation. Like you said, nothing touches you whatsoever, and the doctors are able to analyze your heat patterns, your cell change, and vascular patterns.
Okay, so you can do this to help detect breast cancer, is that right?
Yeah, any area in the body we can use thermography screening. As it pertains to breast imaging, we're able to see very subtle changes, just under 300 cells of change that accompany breast thermography and breast pathology. So it can either be something that's vascular, breast disease, or even an infection.
So how is that, how do you detect more with that versus the traditional methods of detection?
Well, it's looking for something a little different. So mammography is looking for an anatomical structure, so a lump that's already formed. And we're looking for cell changes, vascular pattern changes, up to 5 to 10 years before the structure ever forms. So that's where we get the earlier detection rates.
So we're looking at some video right now. Explain to me how it's done.
Well, you come in like you would with any other doctor's office. You fill out all your medical paperwork. You meet with the technician, and it's as simple as what you're seeing on the screen. You sit down. The images roughly take 10 to 15 minutes. Again, nothing touches you. There's no compression involved whatsoever.
And then what happens with the results? Who reads those?
Medical doctors.
Okay, so you send it to your own doctor and they can look at them?
We actually have doctors read them for you. They come back with a full interpretation, and then we send them out for you to give to your personal doctor.
Wow, and then and what will it tell you? Like, what kind of information can you learn from that?
Well, it's ideal for all women, especially those women who are in the ages between 23 and 55. The denser breast tissue makes it more difficult for effective mammography to take place. So for the 1 in 8 women now developing breast disease, the statistics of women under the age of 40 increasing, this is a great tool to get a baseline on your breast health. And when you do accompany thermography with a clinical examination and thermography and mammography, there's a 98% detection rate.
Wow, okay, so for younger people, they may often just get thermography because maybe they're not getting a prescription for a mammogram until 40. But then after that, women often get all 3 exams or all different ways of detection?
So women over the age of 40, they can add thermography to their health breast screening plan, and it just increases the detection rates. And then certain breast cancers, such as inflammatory breast disease, ductal carcinoma in situ, those are 2 types of breast cancer that don't always form a palpable lump. So when you're going to get a mammogram, they're looking for a structure. So we're able to see dysfunction in those 2 types of cancers through thermography.
Wow. And tell me what else, because I know you said you can detect things all over the body.
Yeah, any area of the body, so from head to toe, we can detect disease and dysfunction. We work a lot with sports injuries, pain, chiropractic issues.
Wow. And tell me, how much does it cost, and is it covered by health insurance?
It costs $155 for a breast scan, and then it's $400 for a full body scan. As of right now, it's not generally covered by insurance, but if you do have a health savings account or flex spending, then it can fall under the preventative umbrella. So I always encourage everyone to call their insurance company.
Great. And tell me where you're located and you can travel to?
Yes, we're located in Bethel Park in the South Hills. We have a standalone clinic there, and then we partner with various doctors throughout the Pittsburgh area and offer our services throughout the area also.
Wonderful. Well, Bethany, thank you so much.
Thank you for having me.
Absolutely. To learn more about heat or health-enhancing thermography in Bethel Park, visit their website. The link is posted at kdka.com/PTL, or you can call them at this number, 855-254-4328. Still to come, a big celebration for the Just Ducky Tours in Pittsburgh and an